Good afternoon, everyone. I'm Jack Knott. I'm the Dean of the USC Price School of Public Policy, and I'm really pleased to be here today for this discussion with Congressman Adam Schiff and Carol Geffner, who is the director of our school's Executive Master of Leadership program. At the Price School, we are interested in working across the aisle to make local, state, and national government work effectively in service of our citizens. And our mission is to improve the lives of people and their communities here and abroad. But to fulfill this mission requires bringing together leaders and change makers across parties and sectors to help determine new and innovative paths forward. We take a data-driven, evidence-based approach to solving the public policy issues of our day. And although the current state of politics, especially nationally, can feel extremely partisan and polarizing, we strongly believe that we can only make positive progress by working together and having tough, honest conversations. To that end, it is my hope that today's forum will be a rich, nonpartisan dialogue about leadership and intergovernmental policy in the pandemic, at a time when leadership, open conversation, and integrity at all levels are of the utmost importance. And I challenge you to listen carefully and to pose thoughtful questions that will push us forward. The Price School is proud to host this conversation today, and we look forward to hosting similar events with Republican legislators as well. We have always been home to engaging and thought-provoking discussions, and the event today is a wonderful extension of that legacy. And I'm pleased now to introduce Congressman Adam Schiff and Carol Geffner. Congressman Schiff represents California's 28th Congressional District. He is in his 10th term in the House of Representatives and currently serves as the chair of the House Permanent Select Committee on Intelligence, which oversees the nation's agencies, including components of the Department of Defense, Homeland Security, the State Department, Justice, and Energy. Dr. Carol Geffner is a professor of the practice of governance and public management and director of the Price School's Executive Master of Leadership program. She also is a counsel and executive coach to a wide range of domestic and international clients, and is an affiliate of Ketz DeVries Institute, a prominent global consulting firm in organizational development and transformation. So please join me in welcoming them both for speaking with us today. And Carol, let me now turn it over to you.
Thank you, Dean Knott. I appreciate the lovely introduction. And Congressman Schiff, it's a pleasure to meet you. And before we dive into our conversation, I want to say thank you for carving out time. I can only imagine what your schedule is like, and I've noticed that it's quite busy in Southern California, and here you are in Washington today. I also want to give heartfelt thanks to your team and to the USC team. Without them, this wouldn't be happening. So I want to say thank you from the bottom of my heart for allowing us to be here today. We have a very short amount of time, so I'm going to dive right into some questions. The pandemic is causing leaders, and we're going to start with a conversation about leadership. The pandemic is causing leaders of all organizations, doesn't matter whether they're large or small, public or private, to face extraordinarily complex issues and equally as difficult trade-offs. I mean, here we are, and I say the global we, the grand we, at a local university, a major university in Los Angeles, and they're in the midst of deciding how to bring back faculty, students, staff, community members, partners to the campus in the safest possible manner, and that's only one example. Tell us about some of the most difficult and crucial decisions and issues you've been facing during the pandemic.
Well, thank you, Director, and thank you, Dean, for this opportunity to address the students today. I've been looking forward to it. It's certainly a very important time to have this dialogue. In terms of some of the most difficult challenges that we're facing We have a pandemic that has now cost about 100,000 Americans their lives, and profound concerns about how many more will lose their lives depending on the actions of federal, state, and local officials. We also have seen a devastation of our economy that has not been witnessed since the Great Depression. The unemployment levels in California are now at Great Depression levels. And so these are extraordinary challenges. And, you know, some, I think, take the view that the health of our economy can somehow be segregated from the health of our people. I don't think that's true. I think the two are quite intertwined and entangled. And nonetheless, there is a vigorous debate going on about how soon to reopen, how quickly to reopen, and what criteria should be put in place before we make those decisions in different workplaces, places of education, in our public spaces. These are obviously of enormous consequence, because if we don't get it right, we're going to see further outbreaks of the virus, a resurgence of the virus, and unnecessary loss of life. So these are tremendously challenging times. I think really quite unprecedented for just about any of us serving in Congress. You know, I think that what is most important right now for public officials is to respond to the health needs of their constituents, respond to the economic crisis that millions of American families are facing right now, suddenly left without an income. And at the same time, to inspire people about our ability to get through this, that we will survive this, that we will get past this, and we need to be thinking about also how we build the country back better on the other side of this pandemic. So those are the challenges that I think we're facing right now, and of course it is a challenge in every level, but it's also a challenge to leadership at each level of government, and certainly in the federal government.
So thank you for opening the door to a very important next question. You talk about how leaders need to be focused on the health issues as well as the economic issues, and we're going to have a chance to talk about even some other dimensions of the pandemic. This raises a question in the middle of a crisis when people are clearly most concerned with their safety and their health. How do we inspire people and encourage people to stay engaged? There are so many issues that still require the public's energy and resources. I mean, we certainly are all aware that there's an election in less than 6 months. And because the pandemic is taking the mind share and the hearts of everyone, how do leaders continue to inspire people to stay involved and to be listening to and engaged in other issues as well?
Well, it's a very good question because, of course, the problems of the world that are not pandemic related haven't disappeared, they haven't gone away. The urgency, for example, to address climate change and the health of our planet has not gone away. And indeed, under the cloak of the pandemic, there are changes being made here in Washington to water down the Clean Water Act and water down the Clean Air Act. And those things could easily escape notice, or people may feel that to even pay attention to these other things when there's such a massive crisis on our hands is somehow to ignore the extremity of the situation created by the pandemic. But we have to really engage in all these issues. I do think far and away, our priority right now has to be the health of our people, the health of our economy, and the health of our democracy. But we also need people to remain engaged on a whole host of other issues. And there are, I think, important opportunities to do so. People don't have to reinvent the wheel. There are any number of great organizations, both locally and nationally, that engage in issues that people care deeply about. And so what I would encourage people is, if, for example, the environment is an issue you care about, if you're concerned and want to have the strongest voice on the environment, then either starting something on your own is always an option, but also there are great organizations, Sierra Club, League of Conservation Voters, so many others that already have the infrastructure in place and can help you make a contribution both to the furtherance of the issue that you care about, but also if you're looking, for example, to get involved in the November election, there are ways to both help candidates that advance that issue as well as help on the policy matter itself. So the best antidote, frankly, to any of you that may be feeling despair about the situation of this pandemic because of what it means for your college or your job or the economic livelihood of your family, the best prescription, frankly, is to be engaged and be involved. There's nothing worse than feeling powerless to do anything about your circumstances. So finding a way to be engaged is just enormously important for the country right now, but I think it's also important for people's well-being.
This is a very important issue. I was recently talking to a large group of undergraduate students, and they were talking about the very change that you were just referring to, and that is many of them have lost their jobs, their internships for the summer, and it's hard to hear when you're young that the best thing you can do at a time when there's, let's say, inaction is to take action. So thank you very much for calling that out. It is the best prescription for energy and just staying well. I'd like to turn our attention a little bit to something that's on the top of mind for most people. As you can see, I am sitting in my home office. The pandemic has brought to the fore something that leadership experts have talked about for a long time, and that is that the separation between work and one's personal life really is no longer in existence. It's been eliminated, and in some ways that's a good thing because we're seeing people more authentically in their real lives. Leaders of all organizations, again, it doesn't matter whether they're small or large, public or private, leaders are having to grapple with such a vast array of implications of the COVID-19 virus. So they're not only having to pay attention to the fact that their constituents and or their employees are working at home, possibly with children or elderly parents, but they also have to pay at the same time attention to the economic implications of their enterprise or their city or state. They have to pay attention to the mental health, the social issues, the transportation issues, the housing issues, and you know this only too well. And I hear it from my clients as well as from my experienced students. Given that I run a program on leadership, I'm particularly interested in hearing what you believe are some of the most important capabilities leaders need at a time when they're facing the magnitude of a crisis such as this.
Well, I would say a couple things. First of all, I think it's enormously important to be able to be empathetic with the circumstances of other people, to understand what they're going through, to recognize the enormous economic anxiety that people are feeling and the anxiety they're feeling about the health of their families. You know, there are millions of Americans right now who have put their whole life savings, their whole effort, their whole energy, all their creativity into starting a business. And they're now seeing that business at risk of being completely wiped out. There are small business owners whose employees are like family, that they're in the position of laying off right now. There are people who work for themselves. They're independent contractors. They work from job to job. They typically wouldn't even get unemployment compensation if they lost their work, who are now eligible for unemployment compensation, but may get a fraction of what they should get. And then, of course, you've got people who are in the position of soon in many parts of the country being called back to work by their employers. in circumstances in which they fear for their health. They're not sure it's really safe to go back to work, but if they don't go back to work, they get fired. And if they get fired, they're not eligible for unemployment compensation. I mean, so I think understanding the circumstances that people are going through is absolutely vital to being able to communicate with your constituents, but also to be able to identify, here are the problems that need to be solved right now. Here's the help that we need to provide. The other thing, you know, in addition to empathy, being able to understand and empathize with what your constituents are going through, is a willingness to be straight with people about the difficulties that are ahead. And at the same time, you know, encouraging people that we're going to get through this, not misleading them into thinking that there are false cures or easy outs or quick fixes or things are going to change immediately tomorrow. That, I think, is a terrible disservice to the country. It's one thing to want to be optimistic, which is good. It's another to mislead people into thinking that there's a quick fix for something. There isn't. You know, in my experience, people are very resilient. Our country is very resilient. If you level with them and tell them what they can expect, they can acclimate to it and they can survive and thrive. But people don't want to be given a song and dance that doesn't turn out to be accurate and doesn't level with them about the difficulties ahead. So, you know, in that category, I would say that the virus is going to be with us for a while. And if we're fortunate, we can cope with it in a way that will not inundate our emergency rooms, that won't result in unnecessary loss of life, that will delay the spread of infection until we can develop good treatments. And there are dozens of clinical trials going on now for treatments. I think effective treatments will come before there's a vaccine for this virus. But that we have to expect this is going to be with us for a while. And the health experts are saying, if it doesn't go away at all, and even if it does, it is likely to recur in the fall. So we may see another surge of the virus in the fall. So people just need to be able to understand, okay, this is the likelihood of what we're facing. And adjust accordingly, adjust their expectations accordingly. And we will get through this. But if we don't level with people, then people are going to make decisions that put their health at risk, that put the economy even further at risk. When you look back at the last pandemic, and admittedly it was 100 years ago, what we found is communities that rushed to reopen before the health experts said it was safe to do so ended up taking much longer to recover than communities that followed the advice of health experts and kept their social distance. And now that might seem counterintuitive. You might think communities that opened earlier had an economic advantage. Actually, they didn't, because the virus resurged. They got sick, they had to close down again, and it just elongated the struggle rather than a more science-based approach. So I think the most important thing, frankly, we got to level the country about what we're going through. We got to put in place a testing and tracing regimen around the country so that we can surveil where this virus goes and know how to stop it. And we need to follow the advice of scientists and not try to cut corners when it comes to people's safety.
You're mentioning such critical issues, and we're seeing already the effect. I mean, I believe, you know, for all of us who were watching this past holiday weekend, you know, we're seeing crowds of people go out, and most of the time without social distancing, or in many cases without social distancing and without masks and protective, other protective gear or coverage, I should say. And it points to a leadership issue around being able to hold the current crisis with the long-term view. And that's something I'm hearing in your comments. You know, there's nothing like a good crisis to show what you're made of as a leader. And this crisis is showing us that at pretty much every level. So being able to talk to people, as you say, transparently and honestly, and holding the long-term view that we're going to get through this, but while also being honest and, you know, nose to the grindstone while we're going through it is what you're saying. And it's what, again, leadership experts are trying to share with people. And we're seeing a range of human behavior along the way.
And Director, I would say also, and I think that the absence of another leadership quality is resulting in some of what we're seeing in those images of people crowding around each other, not social distancing themselves, not wearing masks. And that is, you know, leadership in a time of crisis needs to be crystal clear. You can't be sending mixed messages and confusing messages and expect that people are going to follow you. And so, you know, and there are too many illustrations to give, but if the experts are saying wear a mask and you go out and you don't wear a mask as a leader, you're sending a message you don't need to listen to the experts. If the experts are saying hydroxychloroquine is not the cure and it's in fact dangerous to take without medical supervision in a hospital, and you're saying I'm going to take hydroxychloroquine as a leader, you're saying don't listen to the experts. If you are, you know, saying that wearing a mask or suggesting in response to a reporter question is just political correctness, then you're going to see scenes like we saw over the weekend where people who decide, I don't want to be politically correct, and so I'm not going to wear a mask, ignore the advice of health experts to not only their own peril, but the peril of everyone around them. So I do think that the more severe the crisis, the more important being straightforward, the more important having a clear and focused message is, and the more disastrous any kind of mixed message or conflicting message is, because it just leaves everyone to their own device. And that's, I think, the last thing you want during a public health crisis.
Absolutely. And we're going to come back to this issue around coordination during the pandemic, but I'm going to shift gears just a little bit. You did mention resilience as one of the qualities for leadership at all times, but we're talking right now about during the pandemic. As of right now, I believe there are 127 women. I'd like to take a look right now at the impact of women in Congress. So I know we're going down a different path for a moment or two. I believe there are 101 women in the House of Representatives, and I would really like to hear your experience, your observations, your views on how Congress and/or the discussions in the House are being impacted by having more women's voices in the room.
Well, you know, in the most beneficial of ways in every respect, and I've been in Congress long enough now to have seen the very significant increase in women representatives in Congress over the last 20 years. Of course, you know, there are some very graphic examples of what the absence of women or the fact that women still are not representative in a representative percentage of the American people in Congress. You see some of the most graphic examples, for example, when there was a hearing in the House several years ago on reproductive choice, and all of the witnesses were men that were called to testify on reproductive choice. And of course, the chair and the senior members of the committee who organized the hearing were also all men. And it just showed the absurdity of that kind of result, which would not happen if you had more women in the leadership in Congress as we do now. Now, of course, the most powerful one in the Congress is the Speaker, Nancy Pelosi, who has been an incredible trailblazer for women. But, you know, across every level and every committee, we have seen the enormous contributions of a more diverse caucus that looks more like America in every way, including vis-a-vis gender. So, you know, with respect to the COVID response, there was a very interesting set of news reports recently about how countries run by women had a much better response to the pandemic than countries run by men. And some of the very successful countries like New Zealand and others had women leaders. And I think that part of the answer is those leadership skills that we're talking about earlier, the ability to have a focused message, the ability to empathize with the people that you represent, the ability to level with people about the difficulty ahead, make decisions based on science and data. I mean, these are all skills that we see in great abundance among the women members in Congress and indeed women leaders around the world. So I think Congress still has a long way to go to achieve parity in terms of representation. But the impacts are not just on issues you would think where women could make unique contributions, like on choice, like on pay equity, but on the whole range of issues, just from another perspective born of a different life experience. And so, the contributions are really quite legion and too many to be able to quantify.
Yeah, so for those who are listening, some might be wondering, well, why did we throw in a question about women in a conversation about the pandemic? And the answer is exactly because we want to hear how is it shifting the conversation. And there are so many systemic issues that have to be looked at right now. And again, in a traditionally male environment, you now have a somewhat more diverse set of constituents in Congress. So that's why we wanted to raise this. I'm going to get back to an issue we were talking about before this last question, and remind everybody what the images we saw this past weekend of people being out in beaches and pools and so on. And the pandemic has brought to light another set of issues around federal and state coordination, partnerships, alliances, and or the lack thereof. I mean, back when, toward the beginning, we saw, as an example, state procurement of medical supplies being interrupted by the federal government. This weekend, we saw states opening in a myriad of ways. The question is, what do you think can be done to improve both interstate cooperation, but also coordination, between local, state, and federal government, public-private partnerships?
Yeah, well, an emergency like a pandemic really calls for both strong national leadership, because the virus isn't going to stop at a state border, nonpartisan leadership, because the virus doesn't discriminate between Democrats and Republicans, extensive coordination and collaboration with federal leadership, state and local leadership, because all need to play an absolutely vital role. Now, in the absence of that, and candidly, I think there's been a real absence of national leadership in the administration, then you have states competing with each other to protect their own citizens. And we have seen this for weeks and weeks, where one state will try to buy protective equipment for their hospitals, only to be outbid by another state, only to be big-footed by the federal government to step in and acquire the protective gear. That kind of competition in a crisis should never be happening. There should be a federal response where the federal government uses tools that are uniquely its own, like the Defense Production Act, which empowers the president to compel industry to produce certain things that are vital to our nation's security and health, like ventilators, like protective gear, like swabs and other testing materials and reagents. And so there are certain things only the national government can do. There is the most important responsibility, I think, of the national government to help lead and organize the states so they're not in a destructive competition with each other. At the same time, because there hasn't been that leadership, what you have seen, to the governor's credit, is the governors acting on their own initiative, forming coalitions of governors, coalitions of states to purchase supplies or to share ventilators or take other action in the absence of the federal government leading. Now, it's difficult for the states to do that. One issue where the federal government really needs to step up and show more leadership is the issue of making testing available. We need to be doing millions of tests every week, potentially millions of tests a day if we're serious about reopening. That should be a nationwide effort led by the federal government. That's not happening. Similarly, we ought to be standing up nationwide an army of people who can trace the virus. States are having to do that on their own initiative, and thus far it's inadequate. And so states are moving under pressure to reopen their economies when they still don't have sufficient testing or tracing, many of them. And so you need both strong national leadership, you need strong state leadership, you need strong coordination between the two, as well as good local leadership. This is not to say that the federal government should be dictating everything. It shouldn't. It should, though, because it has some of the best infectious disease experts in the world, people like Dr. Fauci and others at CDC and NIH. It should be promulgating national standards, leaving it up to the states to go even beyond federal standards that they choose to, but be a reservoir of expertise for the American people so they know what it's safe for them to do, what it's not safe for them to do. Knowing, though, that conditions in different parts of the country may require at times a different response, that some parts of the country may be more ready to reopen because they do have a lower viral count, because their hospitals are prepared, because they do have the testing capacity, because they have organized tracers on their own and they met the necessary criteria. So ideally, you would have leadership at all those levels, leadership coordinating with each other, not competing with each other, a strong national leadership to invoke things like the Defense Production Act, and also to share expertise with the states, but also a willingness to allow state and local leadership to play their roles, because not every part of the country is similarly situated right now.
Do you see any evidence that there will be an increasing pressure for federal, state, local partnerships or alliances and/or public-private partnerships? Do you think that the experience that we have been living through now for several months is kind of building up a momentum that will lead to an improved coordination, or is what we see now kind of what you imagine will be?
Well, sadly, I think what we see now is likely what we're to get. I'm not sure that I see the level of leadership of the administration changing appreciably between now and the end of the year. So I've kind of resigned myself to that. We continue in Congress to pass bills providing more funding for testing, more funding for tracing, but we can't force the administration to spend it. And we certainly can't force them to spend it wisely or competently. We have imposed a requirement that they develop a national testing and tracing strategy, but that was over the opposition of the administration. And so when they're doing it essentially because they're forced, they're not going to do it very well. And so I think that's the unfortunate reality. Now, the good news story, to the degree there is a good news story there, I think is the public-private partnership on things like treatment and vaccine. There, I think the public and private sectors are working together to accelerate the development of new treatments, to make sure there aren't bureaucratic obstacles, to make sure that we can move as fast as we possibly can without jeopardizing the human health of those who would be in the trials. So both with respect to developing treatments and developing a vaccine, I think you are seeing a high level of cooperation between public and private sectors. Some of the most important work is being done in the private sector, both in terms of the companies that are trying to develop these treatments and vaccines, but also nonprofits like the Bill and Melinda Gates Foundation. What they're investing in, and this is, I think, absolutely essential, is multiple chains of supply and manufacture for promising vaccines. And what I mean by that is, it takes a certain amount of time to develop an effective vaccine and to test that vaccine on a large enough sample to know that it works and to know that it's healthy and doesn't produce too many side effects. That is one timeline. But once you've done that, and once you have, okay, I've got a vaccine and the vaccine is effective and the side effects are minimal, then you have to mass produce it. And that's a whole separate timeline. If you wait until you have perfect confidence in the vaccine before you ramp up the manufacturing capability, then you prolong for a very long period the time before that vaccine is available to the public. So what Bill and Melinda Gates are doing is they are investing in multiple manufacturing capabilities for multiple vaccines, knowing that some of these vaccines won't pan out. But if they wait till they see which ones are effective and which are not, then we're going to have to add another 6 months or a year to the timeline even after the vaccine is developed. So that kind of public-private partnership is taking place, and I think it's enormously important.
Let's stay on this topic of alliances and partnerships, but let's take it to the street level. You've been very involved in housing policy and working on homelessness policies. You recognize the gravity of this set of issues for both locally and nationally. What do you think can be done to improve the housing accessibility issues, both, again, locally and nationally, because it is having, housing is having an undue impact on the most vulnerable socially and economically. So what do you see as a possibility to improve accessibility during this pandemic? Or are there any opportunities?
You know, there, I think, are both opportunities and, frankly, necessities, both that we address the unique healthcare risks to the homeless population. It's easy to say shelter at home when you have a home. When you don't have a home, it's a whole other story. But in addition to the particular healthcare imperative, you have the fact that this was already an epidemic, that is homelessness, before the pandemic. And there was already a demonstrable need to deal with this problem. And now during the pandemic, while people are losing their jobs, you want to make sure you don't add to the problem by having people evicted because they can't pay rent because they no longer have a paycheck. So, I think the most immediate demand right now is not adding to the homeless population, working to move the homeless population into shelter, whether that's hotel rooms, motel rooms, or group shelters, making sure that the services that are necessary for that population follow them wherever they go. It's not enough to simply say, okay, we've located a motel room, we're going to help this homeless person move into that motel room and leave them on their own without the capacity to feed themselves, without the ability to provide whatever other services that person needs, whether it's mental health or substance abuse or any other wraparound service that they might currently have provided to them. And this is one of the bottlenecks, which is having the manpower, the people power to meet the needs of the homeless population that are moved to other locations. So what's the federal role here? What's the state role? What's the local role? At the federal level, one of the most important things we can do right now is help to fund what the states and local communities are doing. We don't necessarily need a federal workforce to recreate what is being done by the city of Los Angeles, for example, and the county of Los Angeles, which are an epicenter of homelessness in the country. But they do need the monetary resources to pay those hotel and motel fees to make sure that there are people that can be paid to go to these populations where they exist to make sure they're getting the healthcare and other needs met. So financial resources are among the most important thing the federal government can do right now. But there are other things the federal government can do to incentivize the development of affordable housing. Now, this is a longer term issue than the pandemic, but just to give one example, I introduced a bill pre-pandemic that would create tax incentives if you're selling an apartment building or you're selling some other property, that you sell it to a low-income housing nonprofit, or you sell it to a city's housing agency. It would give you the same favorable tax treatment if you do that you would get if your property had been condemned. Now, why do that? Well, because public housing agencies are competing with investors, sometimes even foreign investors, who are buying properties with cash. And how do you compete with that when often there's a bureaucratic delay associated with a housing agency buying a property for use for affordable housing? Well, one way you compete with that is you give a tax incentive to sell it to a nonprofit or sell it to a public housing agency. So that's what the bill would do. There are any number of other approaches like that to help incentivize the development of affordable housing, to reduce the number of people that are forced onto the street because they can't pay ever escalating rents or mortgage payments. So, I think the challenge is identifying what can the federal government do most effectively, what can the state government do most effectively, what can local governments do most effectively, how do we coordinate all of those efforts. I've done homelessness roundtables, homelessness town halls to invite good solutions from local stakeholders as to, okay, what can I do at the federal level? What's best done at the state and local level? What's complementary of each other? And that's, I think, how we have to approach the challenge.
I wish we could stay on this topic. Clearly, housing and homelessness are going to remain priority issues, and more, sad to say, but even more severe given the pandemic. That being said, I want to honor some of the questions coming in from our students and members of the public. So I'm going to now read and bring in the voices of those who are listening today. And some of these are about our local issues. This is from Christian Port. And the question is, how should we move forward with pursuing a budget that does not leave behind Californians with the highest needs?
Well, that's a very timely question because we see the administration threatening states that don't say nice things about them. If the governors don't say nice things about them, threatening to cut off their resources, or states like California, where there are sanctuary cities, threatening to cut off those states, or states that believe that voters shouldn't have to choose their health or their vote, and that are going to use absentee ballots to allow their citizens to vote safely, that they'll somehow be deprived of resources. The way that we protect the budget in terms of the federal budget for these states from that kind of punitive action is that ultimately Congress is the one that sets the budget. So Congress is the one that appropriates the funds. The president and the administration, they can propose a budget, but it's just a proposal. It goes nowhere unless it's acted upon by Congress. So we have leverage in the budget process to make sure that states are not punished or rewarded based on what their governors say about the administration's handling of the pandemic, to use one example. And we have oversight capability to make sure that funds are appropriately spent. We have stood up, we voted to establish a bipartisan select committee in Congress to oversee the expenditure of pandemic relief, billions and trillions of dollars, to make sure that this money is going out on the basis of need, that it's not going out on the basis of nepotism or cronyism or to reward friends or punish enemies. And so our power is both over the budget in Congress to make sure that states are treated equally, whether they're blue states or red states, but also that we perform our oversight to make sure that the will of Congress as reflected in that budget is being carried out and not perverted.
Excellent, thank you. Going to read another question. The coronavirus has exposed major issues of equity and this is also a follow-on, it's linked to something you were just talking about. David Salazar asks, the coronavirus has exposed major issues of equity in communities of color, such as healthcare, food insecurity, housing, et cetera. How is the federal government going to address these vexing issues? Now, you've already begun to address that. Is there anything else you would like to say?
You know, there is, and I think it's a really important question. And I would address it in two respects. The first is this pandemic is revealing in the most deadly fashion just those same disparities and equities that you were asking about. And so, for example, we see death rates, mortality rates in the African American community that are off the chart due to the COVID virus. And so in communities and in states where the African American population may be less than 10%, you're seeing that African Americans constitute north of 40% of the casualties. And you're seeing, for example, in the Latino community, that Latinos are more likely than any other group to lose their jobs as a result of layoffs from the pandemic. And in case after case, you see that inequities and injustices and disparities that pre-existed the pandemic are being made worse by the pandemic. And we have to not only pay attention to this in real time and address these problems in real time, but we also have to make sure that we build back better when we come out of this. That we, in the same way after World War II and the Great Depression and other sort of cataclysmic events, America built a stronger society coming out of those crises than we went into those crises. We need to do that here too. I was just on a Zoom call yesterday with African American leaders from Los Angeles, talking about the disproportionate impact of the virus on African American communities. Now, this has many causes. It involves pre-existing disparities in terms of access to healthcare. It involves issues of bias at the hospital. If you look at, for example, at maternal and infant mortality rates among African Americans, and you control out for socioeconomics, you still see very explicit and implicit bias against African Americans in the healthcare system. And it has deadly consequences, and those deadly consequences are now even worse. So what we need to do, I think, is make sure that we are directing resources to the communities that are most at risk right now, that we are ramping up, for example, testing and tracing within communities of color that are the most impacted right now, that we make sure that there is good and equal access to healthcare when people get sick right now, that we help with isolation when people in the communities get sick so they don't transmit it to other members of their family, that we look at the disproportionate economic impacts. We have taken steps, for example, in the small business program to make sure that we set aside billions in funding for community and minority-based lending institutions so that we don't perpetuate inequities in access to capital, which pre-existed the pandemic, but may be made far worse by the pandemic. So these are the kind of things we need to do right now to protect vulnerable populations. I would add to that DACA recipients in college that our education secretary wants to disenfranchise from help during the pandemic. We have to look after those that are most vulnerable in our society right now. Because they are most at risk of having a fatal healthcare result, falling further behind in terms of their education because they don't have access to the technology for online learning. In each and every way, we need to make sure that this pandemic doesn't make these divisions worse. And as we emerge from it, we need to build back a society more just, more equitable, and more fair.
And everything that you've been talking about for nearly the last 50 minutes, once again calls forward the importance of leadership, because none of that can happen without leadership that has the right set of skills and capabilities and can think broadly and objectively. So thank you for once again kind of reinforcing the complexity of what we're facing, and that supports the notion of having leaders who can think forward, be in the moment, and think critically and broadly, and listen to science. Aaron is asking, in future aid legislation, do you think there is going to be any policy development that will allow for jurisdictions that fall under the Coronavirus Relief Fund level? I'm not sure that that's a clear question. It's the one in front of me.
Yeah, let me try. One of the things that we have addressed in the HEROES Act, and that's the most recent piece of legislation that we passed about a week or 10 days ago, that responds to problems from the earlier CARES Act legislation, is funding went out to states and it went out to cities. So it went out to jurisdictions above a certain population of 500,000. But for smaller cities, they did not get any direct relief. They essentially had to go hat in hand to the state and say, please help us out. In the HEROES Act, we changed that funding formula to make sure that those smaller jurisdictions would get direct assistance. It still would go through the states, but the states would be required to pass it on, and a certain amount of that aid would be set aside for cities below a certain population and other for above that population. So if that may be the nature of the question you're asking, so yes, we are trying to fix that and make sure that even these smaller jurisdictions get help. We're also trying to make sure that direct assistance goes to school districts. We're trying to make sure that in the business program, small business program, that more of that money goes to the truly small businesses by setting aside a certain percentage, 25 or 50% of the small business funds for those who employ 10 or fewer people. So we are paying attention to exactly those kind of issues that you're raising.
Okay, I'm going to switch gears a little bit and then we'll come back. This is a question that was submitted this morning from a student, and it's about the Supreme Court. And the question is, would you like to see any restructuring of the Supreme Court, such as term limits or additional seats added? So we'll just switch gears for a little bit.
I don't really think, much as I am disturbed by the increasingly rightward tilt of the court and its increasingly partisan character, I don't think that those kind of reforms are really the answer. And I do think that we need people nominated to the court who are, in terms of the lower courts, experienced, and a lot of the nominees to the court right now are ideological and inexperienced. And I think that the choices for the Supreme Court need to be less partisan than the choices we've had in the last couple of justices appointed to the court. And it increasingly concerns me, not just at the Supreme Court, but at the level of the Court of Appeals, that judges are making decisions that fall down along the lines of the party of the president that appointed them. So, for example, in one of the recent Court of Appeals decisions, and this was an en banc decision, so there were a great many Court of Appeals judges weighing in. The breakdown was, I think, almost exactly along the lines of those judges on the Court of Appeals that had been appointed by Republican presidents supported the Trump administration's position. Those appointed by Democratic presidents supported the Congress's position. I think that's really destructive of the idea of the court as a nonpartisan, independent, neutral arbiter. I think a big contributing part of the problem at the Supreme Court, frankly, were the destructive actions of Mitch McConnell in refusing to hold a hearing or confirm a justice nominated by the previous President Barack Obama because he was a president of a different party. They held open a Supreme Court vacancy for an entire year that was unprecedented. I think it was anti-constitutional. And it has created this partisan inclination of the Supreme Court in a very destructive fashion. So, frankly, I think the answer may be less trying to add seats to the court or term limit the court, and more making sure that there aren't leaders in the Senate like McConnell who are willing to sacrifice both the character of the Supreme Court as a nonpartisan institution, but also sacrifice the institutional responsibilities of both the legislative branch in the confirmation process and the judicial branch. I think it was a denigration of both branches, what he did in that case.
I wanted to make sure we had time for that question. I'm going to go back. We have time for one last question, and I'm going to go back to the COVID-19 situation. This is from Carrie Marroquin. How is the federal government going to protect Americans with health conditions and disabilities who are forced to self-identify that they have a condition that makes them more at risk for death due to COVID-19 to their employers? Would you like me to repeat that?
No, I understand the question completely. I think it's a good and very important question. It's at the heart of, frankly, one of the debates we're having right now, which is the effort to have a one-size-fits-all broad grant of immunity for employers to require employees to come back or have the opportunity to fire them. And if employees do come back and get sick, to be immunized even if they don't follow proper health standards. We don't want situations where people's medical privacy is needlessly invaded. We don't want situations where people are forced to come back to work where it would be unsafe for them to do so, or be fired or lose their unemployment compensation. And so we're going to have to work our way through these issues in a way that protects people's health, but also protects people's privacy. And so, these are really kind of novel questions. Part of how we are grappling with these, in addition to the context that you asked the question, is when we need to trace the virus. Somebody comes down with the virus, how do you identify those that they've been in contact with and do so in a way that doesn't violate their privacy or stigmatize other people that have tested positive for the virus? Now, the good news is we have experience in doing this. In Los Angeles, for example, there's some of the most profound experience in dealing with a pandemic and dealing with these privacy issues with communities that have dealt with HIV and have gone through the exercise in the healthcare clinics of, in a privacy sensitive way, being able to reach out to people that have had, in that case, sexual contact with people who tested positive and do so in a way that maintain their privacy. And I think we need to be mindful of those experiences and figure out how do we do tracing of the pandemic in a way that also is effective at being able to identify outbreaks, but at the same time observes people's privacy. Similarly, we're not going to employ some of the technology solutions that they used, for example, in South Korea or in China, which may be unduly invasive of people's privacy online. But you may have situations where technology companies get together and allow people to opt in to share information about whether they have a fever, whether they might be positive, who they've been in contact with. So we're going to have to navigate our way through these very difficult questions of privacy and health. But I think you're absolutely right. The predicate of your question is right. We don't want people's healthcare issues to be needlessly the subject of invasion of privacy. There ought to be a mechanism where people can, in a private way, communicate with their employer, even without disclosing the nature of their health condition, that they do have a health condition that precludes them from either going to work or taking certain risks, given the COVID situation.
Thank you very much. That's the formal ending of our conversation. I wish we had more time. There's a whole list of questions that has been streaming in. I want to thank everybody who has tuned in today for taking time out of their day to listen, and hopefully through your commentary, they've learned a little bit more about how we're going to get through this pandemic in a more cooperative and coordinated manner. And I want to thank you again. I know you're going to be called onto the House floor in a moment for your other job, your real job. But I want to thank you for joining us here at USC and Price, and on behalf of my program. And we'll be following your many other local conversations that are taking place this month, and wishing you well and good health, and just want to say thank you.
Well, thank you. I really appreciate you inviting me. Thanks to the students for their good questions. And just to conclude, I'd like to say, go Trojans, except when they're playing Cardinal.
You have to go like this. All right. Thank you very much, Congressman. Be well.
You too. Thank you.